Well, hello and good evening. Welcome to Positively Positive, and I am your host, Susan Mintz. This show has been amazing. Amazing for many reasons. Number one is we are sharing information, education, resources, all about HIV and AIDS. We are telling people's stories. Well, they are telling me their story. They are telling me where they work. They're telling me about their life. They're sharing some of the most intimate parts of their life and some of the most informational, educational, resourceful parts of their life. That's what's amazing. 20 years ago, I had this vision, sitting in a studio with purple chairs and a production crew and the guests sitting right beside me where I could interview them just like this. Only I didn't expect it to be remotely. And that's okay for now. We are all remote. So that's why it's still working. But I have that vision that one day this show will be in purple chairs in a formal studio, and it'll be the same but different. And it's a wonderful thing to have hope and faith and see something in your head that you know can happen. So Positively Positive is anybody, all things, everything with the same component of HIV or AIDS in it. We are the only show of its kind. No one else is doing it because no one else was supposed to. This show is about my life with your life, my story with your story, everything and all things HIV, and the timing was right for this show to happen. And it's doing so well because of people from all over the country, as well as in Palm Beach County and South Florida, wanting to talk about HIV. When the mainstream doesn't, we will stream the best we can all the time. My story is on my website, susanmintz.com. Also, all the episodes of Positively Positive that we've aired, about 11 or 12 episodes, they are on my website, also on a Positively Positive page. It gets posted every time we have a show. It gets posted so you can see all the previous ones, or you can go to Campbell Health Solutions and you can see them also. But you can go, my books are available. My story is called Committed to Love. And it's the story of my love for Dr. Jeffrey A. Mintz, a childhood friend, a childhood. He was my best friend when we were kids. Yay, got that out. And it just was wonderful to be with him for 37 years of friendship, though for 25 years he was a bisexual. I loved him and I stayed with him because I was supposed to. He was my love. He still is. I miss him. But this show, the books, and everything that the Lord opens up for me, all these doors that open up, will always be about HIV and about love and hope and faith. So Dr. Jeffrey A. Mintz, who's looking down on me and saying, you go, girl. You did good. You can read my story on my website. You can hear my story. You can see it. I'm an open book, literally, Committed to Love. Amazon and Barnes & Noble are on my website. And my other book is called And I Held Their Hands with a Hospice Heart. Stories of love, hope, faith, love and loss. Reality, folks. I am reality. There's no teleprompter. There's no cue cards. There's nothing. It's my camera, the microphone, the guest, my producer. We're all remote, but everything's the same. Positively Positive is an incredible show. And if you don't share it with your friends or family or other people in the community where you live, then you are doing yourself a very big disservice. So please share. And the other thing will be, it's our, what did he say? Our 21st. Oh, see, let me back up a tad because time is, I was just notified by my producer. This is our 21st show. Well, we've only aired about 11 or 12 because I air every other Monday night. And we have so many people that we have interviewed and are interviewing that we're kind of backed up with that. But we have interviews that'll go through June. I mean, it's exciting, okay? But this is our 21st show. Yay, that's a lucky number. So anyway, get my books if you want. Committed to Love, and I Held Their Hands with a Hospice Heart. My stories on my website. All the shows are on my website. And now it's time to take the glasses off. because you know what that means. No makeup tonight. I'm having an issue with my eye. So we're going to put the other glasses on as camouflage. Positively Positive with Susan Mintz. Tonight's guest, I've met her several times at the Palm Beach County HIV/AIDS Care Council. Marvelous, marvelous group of organizations and people. Palm Beach County HIV Care Council. One day I should be an official member, but I've attended most of the meetings, and that's why I've met so many marvelous people, including tonight's guest, Dr. Daisy Wiebe. I'm going to read you the title of what she sent me in her bio, which I like to use the expression, I'm always so impressed with academia, scholastic abilities, because I'm not that third person. I am on the streets. I am with the people. And so anybody who's got these PhDs, EDDs, and are members of these organizations with real scholastic, I admire them. Daisy Wiebe, here you go. I have to look down because I have no teleprompter. So she's telling me again, it's our 21st show. Thank you, Richardo. Anyway, Dr. Daisy Wiebe, PhD, MPH, Quality Management Clinician of the Ryan White Part A MAI programs, ending the HIV epidemic initiatives, Palm Beach County Community Services. Can you imagine what that is, what that entails? This is a brilliant woman who was blessed this show to come on. She's not only beautiful, but humble. That's something you don't find all the time. Beautiful and humble. She's also smart and compassionate. So I'm going to say, without further ado, Dr. Daisy Wiebe, come on into the studio. Pretty lady.
Hello. Thank you for that wonderful intro.
The picture you sent me was just beautiful. You are. That's how I introduced you. I said she's beautiful and humble, smart and compassionate. That's what I picked up from the few times I've met you at the Care Council, but from your bio, that I saw beauty and humility and structure, organization. And I'm sure I did not read your title that you have right now. Is it with the government or the Palm Beach County? Tell me your official title, then I'm going to back you way up to where little Daisy was born and started her career.
Sure. So you're right. I am a quality management clinician. What that means is I work with quality improvement and data. I work for Palm Beach County. So the county government actually receives Ryan White funding, which is funding for HIV or persons with HIV all over the country, but in Palm Beach County is where I work to provide medical and supportive services. So my role, as I said, is quality improvement and data oriented, but really working with agencies who receive the funding to try to improve health outcomes for people with HIV.
Wow, that's a lot. So in other words, though, you're involved with funding for the Ryan White Part A and the other parts. So you're into planning and funding and the big stuff.
So yes, the funding comes from the federal government. This is something that Congress has passed since the 90s for Ryan White Part A. And then MAI, Minority AIDS Initiative, came. And then in the last 5 years, we had Ending the HIV Epidemic funding, all federally funded programs. I don't make the funding decisions, actually the HIV Care Council, but I am involved in some planning. And really there's a part of our requirement actually for our programs from the federal government to have quality improvement. So not just providing services, of course, that's always very important, and that's the bulk of what everybody's doing, but also trying to improve the services that are being provided to clients.
It's a very big responsibility, though, isn't it?
Yes, it is. I have a good team though. So my boss and my teammates, we help each other out. So certainly get that support.
You're all coordinated to be able to handle such, you are a team, as you said, and in order to handle such a, I mean, you're an overseer of a tremendous amount of responsibility, and you're only as good, I think, as your team. So you must have a pretty good team because obviously it's working. Now, I
Yes.
only met you a couple times and I never really spoke with you much other than I watched you walk around with such an ease and an air of confidence that I almost was a little intimidated to even ask you to come on the show because I didn't want to take a rejection of no, I have to ask my boss or no, I don't know. And I wanted you so badly because I watched you and I listened to that voice and I said, she's got to be on the show. But there was a little intimidation, even in me, because I didn't want you to say, no, I have to deal with something. So I'm so glad that you accepted and you were very wonderful about accepting. So that's what this show's about. You know, sometimes people are a little hyper before they go on, they're nervous. At the end, they're so relaxed, and others are just, mellowed out. We're just talking and having a good time. What I want to know is, so we got a little what you do. We'll go way more into that later, but where were you born? And take me on a little Miss Daisy journey before you went to the University of Washington and became who you are this way.
Yeah, sure. So I'm a first generation American. My family's from Poland. My family immigrated in the 80s when Poland was still under Russian kind of rule, occupation. Well, at least the government was certainly propped up behind, um, the Soviet Union. So my parents immigrated. My parents are chemists.
Oh,
They found yes.
I
They
said you were
found
smart. I said you were smart. Oh, duh, you think where she comes from? Her parents were chemists. Like, well, sure, they're making cakes right now. Okay. Oh,
so they got and this is back in the 80s before internet, obviously. So they, this is old fashioned letters and phone calls to figure out where my dad could get a postdoc opportunity. So he has a PhD, and he found himself in Utah, which is just by happenstance. It was nothing else about the area except that the university there was doing the same type of research he was, doing. He got invited with, some stipend. Obviously, he was going to get paid a little bit to be able to support himself and his family. So I have two older sisters and my mom. So I was kind of a surprise along the way. So my mom traveled when she was 9 months pregnant, and I was born 12 days later in Utah, and that's where I grew up. And in a very conservative monoculture where I didn't fit in. As far as as the religion goes, there's a very predominant religion there, and so growing up, I certainly felt different and kind of an outsider. But my family was very supportive, and I just kind of focused on academics, and that's kind of and the outdoors. The outdoors are beautiful in Utah, so lots of outdoor activities.
I always say if you just watch somebody long enough or listen, you'll find out almost everything you need to know. And as I said, I've watched you at these meetings and I've listened every once in a while when you said something. And when I say someone is smart, I always admire scholastics and academia, as I've said so many shows, because that was not me. I was running away from home and on the streets, running around wanting to talk to people and just find out about life on my own. So I just think someone like yourself, you come from that rich heritage, that Polish, like I do. My grandparents are from Poland. That rich Polish heritage, that earthiness. We're grounded type of people. And then from Utah, though, I'm sure you did feel a little bit. Do you have any siblings?
Yes, two older sisters.
Are they PhDs also, or physicists, or nuclear scientists, or heart
Yeah,
surgeons?
they both have PhDs. So I joke that they paved the way and also set a high bar. It was never really
Uh,
a question whether I was going to do it or not. It was kind of sort of an expectation. or at least just for me to kind of, wow, this is what we do in our family. And it was kind of just the norm. I didn't really think of it as anything special.
You sure? And what do you do at Thanksgiving? All of you with all your PhDs, what do you talk about? Light things, right? Like what's going on in the world. Oh my heavens.
Well, we all have kids, so I guess the kids kind of run the show now. So we don't get into too many heavy academic topics.
So your parents, though, chemists, are they PhDs also in chemistry?
Yeah, my dad is, and then my mom has a master's.
Wow. So it really is an incredible group. So you went to the University of Washington. So you had a reasonably normal upbringing, if you can say that, with all this wonderful education. But you really had, other than not fitting in with the religion that's there, basically, you were at the University of Washington getting your doctorate, correct?
Yes.
All right. Now tell me why your thesis. My late husband was a doctor in psychology, and I typed this thesis up, so I know it's a detailed thing you have to do to graduate. And there were not one mistake in it, but we were holding our breath when he had to get three of his people to prove it. But so tell me, though, why you chose this subject pertaining to Kenya. I found that so interesting. See, I get to know somebody differently. I don't get to know you from this show gets to know people personally, as well as what they might be doing in their jobs, or if they are HIV. I mean, it covers everything, and we're able to have the time where we're not constrained. So you went to the University of Washington, and you got your thesis, your doctorate in. Tell me about this.
So University of Washington is in Seattle, but the work we did and the work I did for my dissertation was in Kenya. When I did my master's of public health in Utah, University of Utah, I was very much interested in global health and family planning, maternal health, sexual and reproductive health. Those were my interests. So I had the opportunity to go to Ghana for 2 summers to do community-based participatory research, and then, which is just a fancy way of saying going to talk to people and understand, using surveys, the health issues that are going on. And the topic we were focused on was mostly family planning. And I went back the next summer. I was able to help disseminate the results to communities that we had been in Ghana. And so when I was applying to universities for my PhD, I was certainly still much interested in global health. When I got to the University of Washington, I was those were my interests. So anything in that realm. Again, I kind of started in the family planning, but there was a lot of opportunities, and then there were faculty who were studying HIV. And so as I started taking classes and looking for mentors and faculty, was able to work with a great professor named Dr. Carrie Farquhar. It's an amazing research group there, but she was outstanding in of herself. And she had a R01, which is a National Institute of Health way of saying it's a substantial research project she got funded for from the federal government, and was the topic was certainly HIV, but doing it in sub-Saharan Africa. She had been part of understanding like maternal to child transmission and interventions for that. She's an MD herself, but anyway, when I got involved, I was certainly drawn to the fact that it was still a part of the interest I still had was with maternal health, family planning. The dissertation was among, or the study was among persons who are pregnant and their partners. So trying to get people tested, so mostly the partners. So women would come to the clinic pregnant, and get tested for HIV and all the other things they need to get when they're pregnant as far as health services go. And then there was kind of trouble getting men to come to the clinic. I mean, that certainly happens here in the US as well. It's not like a novel problem or only only to specific areas. So there was an intervention to try to test, okay, what if we just make sure there's an invitation for men to come to the clinic, and also let's test that against going to their homes and getting tested there. So the whole goal was to prevent mother to child transmission, because as a pregnant woman, higher risk for even contracting HIV, but then also if a woman has it, then passing it to her child if she's not on ARVs. And so if she's negative and the partner's positive and they don't know that, it could very well get transmitted to the child. So that was the whole goal. We were able to, the comparison was like, 35% of men were able to get tested when we just sent an invitation from the clinic to please come next time. We'd like to talk to you and see you too. Versus 85% of men that were reached when we actually scheduled a home visit, and then we're able to test the couple together there. And we were able to identify discordant couples and provide intervention then. We were in an area in Western Kenya that 20% of the population lives with HIV. And so it's very high prevalence. And I was able to go for some time there and do some qualitative research, get some feedback about this intervention that we were providing. Also do some data cleaning and getting that sorted as well. But it was an amazing experience. It was great for both experiences, going to Ghana and to Kenya to do this type of work.
Do you still keep in touch with any of the people there?
So yes, I do. There's someone I was thinking, well, I knew I was going to bring up during this show. His name is Daniel, and this was actually during my time in Ghana. He was my interpreter, but he was also a family planning nurse. Very outgoing, very I don't know, just a really warm spirit and just fun, but also professional and cared tremendously for the community. So I got to know him over those two summers. When I got to know him, he did come out to me as being gay, and he hadn't told anyone. And he was wondering if God still loved him.
Yeah.
And so I was able to affirm that for him, at least from my obviously perspective. And continue to stay in touch with him over the years until things did get kind of busy. I got married, had a couple kids, finishing my dissertation. I did lose touch with him after a few years, and I didn't really think much of it until I realized, I haven't reached out to him in a while. And via Facebook, found out that he had passed away, and I was shocked. I reached out to the other people I knew who knew him there, and I said, well, what happened? And all I got was, he fell ill, and he was ill for some time, and then he passed away. And I didn't ask anything too much further, but they basically had said, well, and that's all we know, and so I don't know definitively, but my heart tells me that it was from HIV.
Oh, sure.
And to me, it just, you talk about academics and scholastics, but when it comes down to when you're talking with people, and in that time, I was focusing, like I said, on family planning mostly. And then after that, I had gotten into HIV work, but it didn't occur to me to really have a conversation after the fact. Now I'm in Washington, Seattle, he's back in Ghana, to actually start talking about testing or access to HIV prevention or treatment. And I think the thing I was fearing the most for him was that he was gay. And at the time, even when I was there were radio announcements about rounding up homosexual persons and putting them in jail. We heard about police raids to certain areas. So my advice to him, I didn't really have great advice. It was like these two impossible choices, right? One, keep quiet, don't be who you are, just live a low profile, or be out and proud and face being arrested, and so I didn't know, in some ways, like, what in these two choices. I think in the short term, I was more on the just stay under the radar. But I've shared this a couple times before. I think at a case manager symposium, but I have to, I guess, forgive myself for not somehow being able to, intervene at some point.
Yeah.
And know that it was really the stigma that killed him. But now, I found out a couple years ago that this happened, and it happened a few years prior to that. I've since put his picture, several of his pictures up in my office, and it motivates me to keep going. When I started this work, it wasn't motivated by a personal story like that. And now it is. And yeah, I mean, I'm still in kind of in a grief process and kind of still shocked and kind of wishing I could go back.
What a marvelous experience, though, to do your thesis in this and have a hands-on and to have had this experience. I mean, how many people can say that? You go from Utah to Washington to Seattle, and you meet these incredible people. Your thesis must look like a Winds of War. I'm sure it's got so many numbers and figures and things in there, but that's just a part of your MO, who you are. You would be very thorough, and you probably immediately upon presentation received your PhD. The other thing, though, is it's wonderful that you had that relationship with him, because chances are his spirit is keeping you also, is motivating you in a way that there's more work to do, and you're honoring him by continuing to do that work. Oh, Daisy, get a tissue. I had two other people. Go ahead, take a break and get a tissue. Love is hard, isn't it? Yeah, believe me, I know. The other thing is we had two other guests previously who escaped for that reason. They left. One is from Guyana and the other was from Uganda. I get those mixed up, but they left their country. They left their families. They left everything, and they had to run away because of the stigma there. They were going to round them up. They called them half man, whatever the issue was. It'll come up in the show. But that is prevalent there still. And that's why these stigmas, they keep having babies. As long as you keep having babies, you got HIV all over the place too. The guys aren't going to get tested. You can't stop that problem unless you fix people. And that's not going to happen either. But two of our previous guests, their stories will come up, that is what it's about, is that they were getting thrown in jail. They were getting killed. They were getting persecuted, their families, and they left and came to this country for that reason. And it's real. To talk about today in this country, it's still here, the stigma. That's why this show is breaking barriers, helping to remove stigma. And it's powerful because we know that HIV hasn't gone away, though the meds, of course, help. But get tested and know your status would probably be the most important things that you could bring to the plate, is get tested to know your status, because if not, you don't even know where to begin. And then I'm just sober. How did you get then from Washington into Palm Beach County? And how long have you been here involved with the health department?
Yeah, so I shared it as part of my story a little bit already. I found a partner. We got married. I was pregnant when I wrote the dissertation, and the timing was tenuous. I'm glad that it all worked out, because once that baby arrived, it would have been very difficult to have finished in a timely manner, at least. So I had finished my PhD. I had my first child, my son, and I started doing. I took a little bit of time off, and then I started working part-time for a global health training program. Got to go actually to Kenya with my son, who was 9 months old at the time, which was great. I got my husband to come too, and it was good. But it was also kind of a realization of, this travel back and forth, or where are we going to really get established, and where am I going to really do my work and get my career going? Because there was challenges with all that, with traveling. And my husband's a psychiatric nurse practitioner, and part of that is most people have a lot of student loans when they end with school like that. So the loan forgiveness programs, like when you work a certain number of years and a certain amount of your loan gets covered, are based in the United States. So so that was another practical reason. So coming back from that trip, and kind of recognizing, well, we need help also with this baby, was to relocate where he was from. He's from Palm Beach County. He grew up in Palm Beach County. So my mother-in-law lives here. And so we moved. I also we decided to have 2 children. So I had my daughter. So they're 2 years apart. So I had a 2-year-old and a newborn, and we moved cross country from Seattle to Palm Beach County. And yeah, so then I started looking for work, and it came, an opportunity came up for with Palm Beach County. Actually, it was Dr. Messer's job that I applied for. Didn't get it, luckily, for 2 reasons. But when I got the email, I was like, oh man, I really want, I was hoping this would work out. But I got a phone call very shortly after saying, we would like to offer you a temporary position to start working with us, because they said we want you for a different kind of role. We want you for data and quality improvement. And his position is program manager, right? Which has a lot of, other things going on with it. And yes, I don't think I was ready at that time anyways. So that's one reason. And 2, he's just so amazing that I'm so glad I am so happy and lucky to be, that he's my supervisor, and I'm learning so much from him. Yeah. So it all worked out. So I started a week after him as a temporary staff, and then they needed to create more of a robust quality program. That was one of the findings from HRSA, our funder from the federal government. So they were able to approve positions that were more quality related. And so then they opened it up to everybody, and I was one of the people that was able to, or anyone could apply, but I applied, was able to get that job. And then here I am. So then I became full-time. And so I've been here for working in my role 5 years. It's actually my 5-year work anniversary, like in a week or so here with Palm Beach County.
You said your husband is a psychiatric nurse practitioner?
Yes.
Where does he work in practice?
He works, he likes to keep things interesting. So he works several places. So he works at a rehab in West Palm Beach for adolescent males. And then he works at a community health clinic for Florida Atlantic University in Westgate area, and also on Tamarind, in the Tamarind area, so not far from where our offices are, just a few minutes north from where we're based. And then he does do some private practice telehealth from home.
And your 2 children are in school now?
Yes. So they are, my son just turned 8, and my daughter is turning 6 soon.
Do they have PhDs already?
No, not yet. No.
Well, they probably have bachelors, and they're working on their masters. That's wonderful. Yeah. It's so wonderful. I just love stories. As a writer, every once in a while you'll see me look down, because I'm documenting, even though I can go back and listen to the interview, I document in between my questions, because I'm writing my next book. Going to be called Positively Positive, the stories of HIV/AIDS you never heard. And that's why these shows are all so marvelous, because one of these days down the road, I have another book, because I like stories. I can't make stuff up. I can embellish or fabricate a little bit and change a name or a city or what, but the nuts and bolts of something, I can't change this, what we're talking about. I could change Kenya to another place. I could do a lot of things, but the nuts and bolts of how you went from where you went to where you are and what you do, you can't change that. That's why live is wonderful. More even than sometimes reading. because reading is still limited, but when you have the visuals and you actually can see somebody and talk to them, it's a whole different world. But I'm a storyteller and I love hearing stories. Now all right, so we got you while you're here, but you integrated mental health and substance use. Tell me about that.
So a few years ago, we applied to be part of a quality improvement project nationally, and there were about 100 sites that were selected, all HIV related. So whether it was a clinic or an agency, or like us, like the recipient or the government agency, we were a part of this quality improvement project. There were 4 areas. Of course, all of these things matter, right? Housing, age, substance use, and mental health. We had submitted some data like, well, how common are these, issues among our population? It turned out that mental health at the time, because we had a self-report, we still do have a self-report question that case managers ask as part of their assessment about mental health, and self-report, it was very high. It was almost half of the people who were being asked the question were saying that they had or were currently experiencing some sort of mental health concern.
Mm-hmm.
And so we wanted to be able to implement a screening, though, because we wanted to make sure that people who might not be as aware also get help earlier and intervention earlier. So we implemented the PHQ-9, which is the Patient Health Questionnaire. It's 9 questions to screen for depression, as well as the Substance Abuse and Mental Illness Symptom Screener, the SAMIS tool, that looks more about broader. So substance use, alcohol use, and things like anxiety and PTSD. Pretty simple screener, but still getting an idea of who is screening positive, and then working to get referrals to mental health, which we also fund with our Ryan White dollars, is mental health care. So case managers now ask these questions before, some clinics do ask them, some don't, it depends. And so now across the board, case managers are asking these questions among their clients. And so, we went from, not doing it really. I mean, certainly case management wasn't doing it, to we met our goal. We're above 80% of clients who are being seen with case managers are getting these questions asked regularly.
That's great.
Yeah. So getting that help and awareness, and counseling. And part of this was also training case managers. We had a lot of questions about, is it okay to ask about these things? Right. Is it going to prompt anything? What do we do when they say this? So a lot of questions. And we actually connected. We had training with our mental health providers to talk to case managers to answer their questions. So has been really positive. Project that we.
Even in the world, it's not HIV. In the world, in our country, let's say, I don't know the world. I'm using our country. Mental health is such a big issue, because there's a stigma attached to that. And these stigmas, you internalize them and they fester, where they eat at you and they can eat you up, and the mental health especially. So if you're HIV positive, that alone is a trigger, it's a red flag. And then if you either have anxiety, or your family doesn't want you, or you lose a job, or you can't get things, it all compounds itself. And I know from having been in this field 40 years with AIDS, I've been involved with AIDS for 40 years since I first heard of it. And then with Jeffrey being bisexual, I mean, we lost our whole neighborhood. I'm really aware. I don't know the things like you do, but I know what's going on in my community and in Florida and in the world, because of being hands-on and involved that way. But it's just interesting, because mental health, there's an amazing amount of money for the military, but there's so little on mental health. And then you just saw in Baltimore where the bridge went down. That's infrastructure. Yes, but that's not infrastructure like the clients you see, like the people I've lost. That infrastructure to me is not a building. Infrastructure to me is the people. So where is the neglect? mental health, for dollars for the insurance company. I'm so in here with stuff that I don't even get into that. But if you're HIV positive and you have issues, where do you go for the mental health then? What do we do? Where do people go?
So for people with HIV who are 400% or below of the federal poverty level, which I just looked up, like for a person of one, it's something. I mean, I know for a person of family of four, because I was looking at it, it was $122,000. So if you have a family of four and you make less than that, you're eligible for Ryan White Part A and Part B funding, as far as like on the client level. So and it's not restricted to citizens. So persons who aren't documented can also be a Ryan White client. They can get health insurance paid for by our program, or they can access mental health directly with our contracted providers. So we have 2 providers, and actually 3 now with our new grant year, who are providing mental health services. So if you're a Ryan White client, if you're living in Palm Beach County, and again, if you're living somewhere else, if you're living anywhere in the U.S., if you're in a major metro area, there's probably a Part A Ryan White, but there's always everywhere a Part B. So there's coverage for Ryan White all over the U.S. It depends on what their planning councils decide what to fund for the Part A's, but in our area and in many areas, there should be in mental health coverage, and certainly I know for a fact in Palm Beach County we do. And then with insurance, then you have an access to providers, and we also cover copays too and deductibles. So it's not there should really be no out-of-pocket cost for persons with HIV who are under 400% FPL. Again, that's a pretty high income to get not only mental health services, but any medical services, supportive services, case management. The funding is there to support them.
My big issue is, though, that it's one thing if you know what to do and you know how to go to get to the programs, and my thing that I find is that people don't know where to go when they have some things. I hope this show, if anything else, if whoever's watching, if they're in Palm Beach County, that they also know how to contact our health department, our people that we have here who we're very well put. Palm Beach County is probably one of the best in the country in many ways with resources. I don't think you'll ever have enough money, and I think you'll always have to jump through hoops and fight for every dollar. But I think as far as it goes with the resources that are here, I think Palm Beach County is pretty well set. But how do you find this out if you live in Kansas, or you live in a little part of Utah, or you live in a rural area where you may not even have a health department for 2 hours? I had this on the last show. I said, suppose you have to drive 2 hours to a hospital or a health department and you don't even have a car. What do you do? It's very challenging.
Yeah. So the easiest thing to do, and I've told people this, is to Google the name Ryan White. This is if you haven't done a show on Ryan White, that would be kind of interesting. So just a quick history. Ryan White was a teenager who contracted HIV and became an advocate. And then Congress actually came together and did something and passed this funding. And that's why it's called Ryan White. It's after his name. But if you Google that name, Ryan White, and then the location you're in, Utah, Kansas, whatever city, probably broad, I'd probably put the state, or if it's a major city, and you'll find resources of where you would go. As far away from if you're in a rural part of the country, more there's telehealth services being offered through Ryan White programs. So you might not be able to go see people in person all the time, but if you can, keep do your case management and your mental health appointments and some of your, physical health appointments with telehealth, and some of these programs can offer a phone or data plan. We do actually. Also, we have a program for ending the HIV epidemic for clients who aren't virally suppressed, to be able to access these things because they are a vulnerable population, to make sure that they get that type of support, and be able to connect with a teleadherence counselor, but also other services.
So you'd say that Palm Beach County is pretty well is in good shape for a lot of this.
I mean, the one thing I've lived, not too many places, but to me, what stands out in Palm Beach County is, like there's so much wealth in certain parts of the county, and then there's so much poverty in so much, many parts of the county as well.
Mm-hmm.
So the disparities are so stark, and I mean, I've
Mm-hmm.
never seen it so apparent.
Mm-hmm.
So I mean, we should be able to address a lot of things with the resources, let's say, that are here, but it's not, doesn't seem like that's the case. I mean, the one thing I will point out is that we, as the HIV program at Palm Beach County, the Board of County Commissioners, we are employees under them, but we get all of our funding through the federal government. We don't have any ad valorem dollars from the county. So we are actually all federally funded. It doesn't really matter in our program, I guess, if the county decides to not fund us or not, because we don't have any funding from them. I mean, we'd love to have funding from them, but they haven't funded HIV programs. So as far as Department of Health, and it's confusing because we do have a health department, and that's Part B, and I'm Part A, which is the county government. And I know people think of the health department as also government. It is quasi-government, and in fact, it's under the state government. So our health department is under the state health department, and they get Part B funding, which is also federal funding. I don't know how much they get from the state to do HIV work, but most of it is federal. So we get most of our money from the federal government, from Washington, D.C., not from the county.
Well, I think what our county and what we need, especially my thing is, we need philanthropic people who have those billions living here in Palm Beach County. For one person who has that kind of money, or multimillionaire, they're building $40 million homes up there near where I go, near the old Key Lime House, wherever up there near Boynton or up that way. I mean, they're building these multi-million-dollar homes. So Belle Glade is not what you're going to see them in. Boca is not Belle Glade, Boynton, and we're going to say up near Jupiter and all these places. I mean, there's so much money. All we need is one person with that kind of money to say, you know what? I'm not going to depend on the government for this. I'm just going to make sure we have transport. It wouldn't take a lot to really fix this problem. One person can really fix this problem if they want to really donate a whole lot of money to this and have the name behind it, because the money can move the money. There's money all over the place, but you have to be in the right position. You shouldn't have to fight for the dollars when you're talking about people. It's wrong. So I'm always going to be a person that's saying, you want to sponsor this? You want to sponsor the show? You got a couple of $1 million to throw at Campbell Health Solutions because of the work Richardo's doing. You want to write a check for $100,000 so we can have a big old party in a grand ballroom for everybody who's HIV positive in Boynton. I mean, I don't care where the money comes from, but somebody here has got to step forward, step up to the plate and say, no, I have the name to be able to get to the people who do the funding. I can do some funding. There's people here who could do some funding to take the pressure off some of these organizations that are real close to losing their money. Because I've watched all these years from the 90s and I've watched the dollar shrink personally. When Jeffrey was diagnosed and when he passed away, there were mom and pop organizations and groups all over. Every hospital had an HIV support group. It was amazing what was going on in the 90s. And then little by little by little, things dried up and slowed down to where now you're having to push through everything. And it's mountains that you have to push to get to what you want. So I'll say some philanthropists out there, start writing some checks and talk to the governor. Now, I also want to understand, what is this? This is wonderful too. When I see you personally next time, I'm going to give you such a big hug. You are so great. Now, I just ask the questions, you take over. Now, what is and I look down because I write on the people I interview are real people and they deserve the respect that they're going to get and the time. And I want to know about you. What is the Data to Care pilot program?
Yeah. So it's pretty exciting. I know maybe it seems dry, but so kind of understanding again that split that, we receive. Okay, so we're the county government, but we're not the health department, which is always, I always have to correct people, but I mean, I still correct my husband to this day, so don't worry about that. As far as the Part A Ryan White program, so what we wanted to do is to address the out of care population, but we don't have data that gets reported to the state. So things like hepatitis. I mean, there's a whole list. There's like 40 things on this list of things that actually get reported to the health department. And that's so that the health department can understand where are there maybe outbreaks happening, where do they need to intervene, where can they do to help protect the public's health. That's the whole intention of having reportable data labs to the state Department of Health. We have our own clients that sign a consent form that say that they're okay with us being able to share information so that we can care for them. Health department is one of the entities, but also any Part A provider is on there. And so, because they've signed that consent, we've entered into this data sharing agreement with the Department of Health at the state level that now we can get these reportable labs that the state gets anyway, but that we can get them directly into our database so that case managers don't have to chase after these labs, because now if we get these imports from our providers, but they also because of health insurance, they can go to a wider network of providers, they can go to other places, and so but we don't get that information back. Like the case managers, it's hard. I mean, they can, but they have to call, they have to sign a release, they have to like it's a big back and forth. So now we actually just happened yesterday, Friday, but then I verified it yesterday. Anyway, this import came in. So that's one part of the data to care, is actually getting this information so we can better care for all the clients. Now we're not doing all the paperwork and chasing papers and chasing labs. Now we have them, and clients case managers can remind the clients what it was. And then we can, if they're not virally suppressed, the providers know like their case manager knows more quickly, because we're going to get this quarterly. The other part of it is that the state will tell us, okay, of all the clients that sign that consent form, these are the people who are out of care, because we have people who, stop coming to their appointments or to case management. And sometimes, they just forget to tell them that, we're moving, or I got a job, or maybe they told them, but it didn't get documented appropriately. And so now we have these, clients we don't know what happened with, at least on the big data level. I mean, maybe on an individual, case managers know because they can open up a note, but anything typed up, I can't really run data on, maybe with advanced technology at some point. But so what we now know is like the state has better handle of who is actually out of care, because they know like who's moved to different places. They don't know who's moved out of the country. So that's a limitation, and we know that. But what we've been able to know is, okay, these are individuals who are now out of care. And also part of the consent form now has, you're consenting, if you are to ever fall out of care, that you will be attempted to be contacted so that we can help you get back into care. So they have that in the consent form now. So now we have a team. It's called the Community Outreach Response and Engagement Team that now is in something called the linkage module. And they can help find clients and try contacting them, being very discreet about the whole thing. We did a big training on all of this to try to contact individuals about getting back into services. We're actually in the community services department, the Part A. So and there's other things. There's rental, there's senior services there's veteran services, there's housing, community action. So we just, we're community services, and we're able to link people back into care. We all go into the field. We'll go to an address. We'll ask if anyone by this name lives here. And then, we've had really good success. We've been linking people back into care. Really, they there's certain barriers. There's a lot of different barriers that come up. And now we're getting them into care. So that's what the data to care means, like using all the states have this go, by the way, where the labs get reported to the health department, so they can have information. Again, not just HIV was not singled out. It's anything that's communicable is on this list. I think chickenpox is still even on it. And so we are able to now use that data to really focus on people who need the most kind of assistance or help in either, becoming virally suppressed or getting back into care.
But it's a pilot program. Is it being done other
Oh,
places?
so we did a pilot and now we're actually doing it. So
Okay.
we finished the pilot and now it's part of our program and we're fully doing it. Yes.
Is this initiated anywhere else in the country or the state other than Palm Beach County?
So in Florida, we are the first in Palm Beach County to do this in Florida. So we get that designation. As far as other parts of the country, there's less of a barrier for other states, just the way that their governments are set up, that the health department is not separated from their county governments. And so like their funding is aligned. And so it's the health department that actually gets Part A and B funding. And so then they have access to this. But, even then sometimes there's a disconnect, but they have access to this data more readily. So there is, that's where it actually kind of came out of like, hey, let's use this data and help people get back into care.
That's great.
But for us, we had to overcome the Florida challenges, which, they're sometimes.
So the pilot has landed the plane where you are grounded in an official program. Let me ask you one. What is, so you can tell I've read your bio. What does IDEA mean?
Okay, so the IDEA stands for Identifying Disparities to Engage Action, which is the IDEA project. So myself and my colleague, Jasmine Parrish, also a quality management clinician, started a project last year with all the agencies that receive our funding to do a quality improvement project together. I mean, it was a kind of a hybrid model where we were trying to accomplish certain things by certain time points, and we had work group meetings along the way. But the goal was the same, was to identify disparities in their data of which group of people might be falling behind in terms of viral suppression or retention, and then creating an intervention and testing an intervention to see if we can address that. And so throughout the year, each agency, looked at their data, came up with the root causes of what they thought was going on. From that, developed some sort of intervention they wanted to try, implemented that intervention on a small scale. They did a plan, do, act cycle, just to kind of almost like a little, experiment to see, did this work? And then did it with maybe more individuals. And then at the end, we actually just had a quality improvement showcase, Susan, that you attended. And we had each agency have a poster to show what they actually did. And yeah, it was really great. I mean, I think we started because we were finishing up a project and then we were starting this one. Some agencies hadn't gotten as far along as they had wanted to. So they're still doing a couple PDSA cycles and working with more clients. But I mean, as far as, impacting, the clients, but also learning about what worked and what didn't work, collaborating with one another. Yeah, it was great. It was a really good project and success. Yeah.
I think that's when I spoke with you about being on the show at that event. It was excellent. And that's what we're just doing here, is just sharing resources. I mean, Arizona, New York, it doesn't matter. We're just sharing information, and that's power, that education. It's also important. What I think you're the type who probably likes starting or taking on an initiative. I think you're a person who's not afraid or fearful of trying something new if it benefits people. It's better care. It has to do with better quality of life. You appear to be someone who's not afraid of a challenge if it means that we can make it better.
Yeah. Yeah. I mean, I get excited about I think more about the impact we could have, and then I, so I start there, like, oh man, it would be so great that if we could, the things we've already talked about, the mental health screening, the getting the labs from the state, using that to get people out of care into care, and doing it in a way that goes to them. I think that came out of really my work in Kenya, doing home-based kind of interventions, like, hey, why are we waiting for people to come to us? Can we reach out a hand and help them out? Using technology, using the app that we have, like all these started as like, wow, that'd be a great idea. And I've had to learn to have patience because, to me, I'm like, okay, well, that should get done in maybe 1 year, like, or less, And some of
Why
these
wasn't this done yesterday? Yeah.
Right. Some of these things, barriers with all sorts of things, right? Red tape, you're collaborating, it's taking time. There's a lot of other, people have a lot on their plates. And so you're asking them to prioritize your things. And then, I think I've gotten pretty good at motivating people to do those things that I'm passionate about. Cause I think they see like, oh yeah, this is really great. We really should be doing this. So
yeah.
This
show is an example. Why hasn't this show been done? It's been 40 years with HIV. Compared to cancer or a lot of other conditions that have been around for, since the birth of Christ, just in general. Why did this show take so long? Because the right timing, the right person, the right approach, and the diversification. I was ready because it was supposed to be my show to be able to do this. And it's marvelous because that's what we're doing. I'm excited when I leave this interview. I'll be as high as much dope as I've ever smoked because I know that this show is meaningful and necessary and needed for the same reason. You can be fearful and stop something, or you can be excited and try. What's the difference between fear and excitement? Someone will say, well, you're stressed out. No, I'm not. I'm just really thinking how great this. People use adjectives to describe you when they don't understand you. I'm an overachiever. I would assume there's a part of you that's an overachiever because you wanted things done yesterday when you say, well, why couldn't this have been done? That's why a Daisy Wiebe comes into the picture, because she'll do it. You are a planner, you are a programmer. Everything in your bio said, we can do this. Let's try. What do you find the most exciting? What part of Dr. Daisy Wiebe's is what do you find the most exciting that you really love that you do, that one part, that one nut?
So
take your time.
You probably have heard, I get the data, I get excited because I see numbers go up or numbers drop, whichever direction they're supposed to be going that we want to see. And I have a connection to the data where I know that those are people and those are people's lives. I know some people would say, oh, that's just a number. You don't care, it's a number. But it's like, no, I care because it is a number. It is and what I like too with our ending the HIV epidemic initiatives is that we brought those are in-house. So I get to work directly with the staff, directly with those community outreach workers, directly with the teleadherence counselor, and I get to hear, like just the other day, I helped get a client into care because the outreach worker asked me like, hey, I ran into this and this problem, where should I go? And I said, okay, I'm going to call this person and that person. And then they transported we also provide transportation. So we picked them up and they took them to the appointment. Mm-hmm. It was rapid entry. I called and I said, they're there. And I was like more involved, like in the little details. Yes. That was really exciting. And I get to hear more of those. I get to hear more of those stories now, especially with that work, because that's and I do hear it from case managers in our quality work.
Yeah. You're finely tuned, Dr. Daisy. You are finely tuned. How could people reach you? Give us your email, or how people can call. Where can they contact you? Because after this show airs, there's going to be people who are going to want to know much more. How do we contact you?
So the best way is my email, which is on the screen. I'm glad. Thank you. I don't have to spell that out. But for those of you who are more audio oriented, it's DWIE, like Edward, B like boy, E like Edward. So DWiebe at PBC, .gov. So PBC for Palm Beach County and .gov. Yeah, that's the best
wonderful.
way. And then, then we can have a phone call chat, but my email's the best way.
That's great. So, and you're on Detroit, your offices are on Detroit where the big health department is, correct?
Yes.
Because most of the time the meetings with the Care Council have been at that Maxine Frederick building. And he's still telling me I'm waiting for the music because I can tell. You can tell me I got another message. This is our 21st show. I lose track of time because I'm so excited with every guest. You have people. You might even have a client. Thank you, Ricardo. We heard it. Very nice. A little heavy metal next time. I'd like some Guns N' Roses. The other thing is, would you, people, if you have any clients who would like to share their story, the link you have, or they can contact me or Ricardo, and we'd have them on if they want to talk. That's what, some people are organizational. Some people are personal. They want to tell people how, when, where, and why. So if you know any people, if you have other people in your venue of what you do and they want to be on the show and share more information, we welcome everybody. I love this. I mean, it's like this was just a wetsuit for me. I just love it. But any people when you mention that you've been on, please, if they're out of the state or if they're in Broward or Miami, because this is reaching people. We may not have 10,000 views or 100,000 likes or 1 million. It's not that. There could be the one person on the other end of this show whose life you saved. And that's literally whose life you saved, just because there was a phone number up. Just because we did a show once in a while where HIV was the focus of everything. And we want you to live healthy. It's not a death sentence. There's nothing wrong with you. You should not be ashamed. You have value. And there are people out there that love you. So please, if you have anybody that wants to be on or has a story or share more of the organs, we'd love to have you on. And I probably could ask you another couple of dozen questions. I still can't get over so much of what the Data to Care pilot program and the IDEA. I mean, to me, this is so, it's like everything you do is a thesis, Stacey. That's what gets to me. It's like everything you've done is a mini thesis of who you have been and what you did your thesis in. I'm just in awe. Next thing I said, when I see you, I know, so you can't know a person just by working with them. You can and you can't. But I think to me, the personals come in when you find out, where are you born? Your parents are from Poland and they came here in the 80s. That is wonderful. My you share with the personals, you get to know somebody that way. So if you have anybody that wants to be on Positively Positive, I'd love to have them. And for you, thank you. And we're still going to continue to talk. I just want to make sure I got a real big thank you in to you for being so openly. Yes, I'd love to be on the show. And I'm thinking, oh, I didn't want you to say no. I really wanted you to be on so badly. But I'm so proud of you and happy for you and your family life. And it seems like everything's going great until what's the next project you're going to take on?
Well, we have mobile units, and that's so far I haven't gotten, and we have other staff kind of working on that, but that's something new.
Yes.
We have continuing to work with the linkage and the PL. Oh, for PL Cares, we're trying to improve. We're actually integrating more mental health. We're working with the University of Florida. There's a professor there who and a faculty member who's interested in improving the app that we have and adding a more mental health components. And there's the intervention is kind of like mindfulness and positive. There's a positive affect intervention that's going to probably be incorporated anyway. So we are involved in as a site to improve the app that we already have, and this is an app that's actually also in other parts of the country and in some parts of other parts of the world. So I guess continuing to improve. I mean, it's where we find where we need to improve is where it's going to go next.
You grow,
their
you
quality
continue to
of
grow, you continue to evolve. You don't stay stagnant. Water doesn't stay
life.
stagnant or it breeds stuff. You're
Mhm,
not a stagnant lady.
mhm,
And there will always be opportunities presented to you because of your personality and your detail, your attention to detail. I admire you an awful lot for what you've done and continued great work. You got two wonderful kids and a husband who's supportive, and it's been wonderful. Thank you. So I just thank you, Dr. Daisy Krakow. Tell me your middle name, your maiden name.
Oh, well, the Polish way is Krakowiak, but the
Krakow.
anglicized way is Krakowiak.
Yeah, Krakowiak.
No, there you go.
Yes,
Mhm.
because I'm Polish and like Krakowiak. Yeah.
Mhm,
I,
mhm.
I'm at the pool when I'm around. I have a lot of neighbors that are from Russia, still from Russia or Ukraine. And I love hearing them at the pool because I feel like I'm in another country. And that's would be their accent, would be Krakowiak, don't you know? Yes, so
Mhm.
it was really great. And just thank you.
Yeah, one thing I never mentioned, which I was planning to, is that, I started in global health, and I would say I stayed in global health because, in the United States and also in South Florida in particular, I mean, we get to work with so many different cultures and
Yeah.
people. So that's wonderful too. I mean, certainly more diverse than Utah. So
Yeah, I would. Yeah, right. We're
anyway,
very,
so
even our state is very diversified.
yes.
Gainesville is not born, is not South Florida.
Hmm.
Tallahassee isn't. So this state is a challenge in itself. It's like half a
Hmm.
dozen states in a state.
And the state
So
needs help too. I mean, that was another thing when we moved, and I looked at like I was working in HIV, and I was so globally focused, and then I was kind of looking around. I was like, wait a minute, the epidemic is in Florida. Like the like major,
yep,
this state is number one in terms of like number of infections and number of people
yeah.
with it. And I realized like, oh, this must be destiny. Like my husband's from Florida. I'm going there. I've done this training and education. So yeah,
Welcome,
it's
welcome to the HIV breeding ground, Dade, Broward, and Palm Beach County. It looks good on map, but it's a tough place if you're HIV positive. Though we have the
Mhm.
resources, we are a breeding ground right here, and it'll change one day. I hope
Yeah.
that
Well, I wanted to come and be where,
the
there
action
was,
was.
well, where there was more, yeah, to do, right?
Yeah,
I
yeah,
wanted the challenge. I
opportunity,
wanted to
work,
where there was, yeah,
work to do,
yep.
work to do. Krakowiak, work to do. Yeah, but I hope that also that the national media picks up and starts talking about it because that's what we need. We need visibility. It's gotten so pushed away because of other things, and I think one day if HIV should surface, whether it be with our youth or with the elderly, the senior sector who's been promiscuous, the complacency about HIV and AIDS is very sad to me because you cannot take this virus and be complacent. So I hope that one day um, there is more exposure, and I mean literally media exposure to this again, like there used to be. I say we need an act up two on steroids. But Dr. Daisy Krakowiak Wiebe. Where's your husband? Where's that name from? Wiebe.
Um, Not quite sure. I mean, I think it might be Germany. But he's mostly Irish,
Yeah,
like Irish background. I mean, it's been several generations now, but yeah.
yeah, not Poland. But again, I want to say thank you to my wonderful guests on this show tonight, and we appreciate all you're doing and for all the thousands of people over the years you've helped one way or another. Is that you're a blessing to everyone who comes in contact with you, and just keep doing good works like you do. You
Oh,
know
thanks so
you.
much, Susan. Thanks so much for taking the time to talk with me and ask questions and being interested. And
Oh,
it's very nice and very, very
I
kind.
am. I'm fascinated by these stories, and I'm fascinated by people who push the envelope to make it better, to take on a challenge and not be afraid, or to risk no and be more afraid to hear that to go forward. Like I said, I was a little hesitant because I didn't want you to refuse, and yet I'd be more afraid not to ask.
Mhm. Well, thanks so much for the invitation. It's been really great.
And send us some people. Send us more because it's been 21 shows we've done, but we only